Good afternoon, everyone. Bon après-midi. 12 jours se sont écoulés depuis l'annonce des mesures que nous avons mises en place pour ralentir la propagation de l'éclosion de COVID-19 dans la région de Campbellton-Restigouche. Ces mesures ont exigé des sacrifices et de la vigilance de la part des résidents de la région et je tiens à les remercier pour tous les efforts qu'ils déploient. Comme ce virus a une période d'incubation de 14 jours, de nouveaux cas surviendront malgré tous nos efforts. Comme je vous l'ai dit, la semaine passée, il y avait 300 personnes qui isolaient à la maison. Alors, pendant le cours de durée de 14 jours, on savait qu'il y en aura parmi eux qui peut-être devront positifs. J'annonce aujourd'hui qu'il y a 9 nouveaux cas de COVID-19 à signaler dans la province. Tous ces cas sont dans la zone 5, soit la région de Campbellton-Restigouche, où se trouvent maintenant 24 cas actifs. Les nouveaux cas sont répartis comme suit. 2 personnes âgées entre 60 et 69 ans, 4 personnes âgées entre 70 et 79 ans, une personne âgée entre 80 et 89 ans, 2 personnes âgées de 90 ans ou plus. It has been 12 days since we announced measures to slow the spread of COVID-19 in the Campbellton-Restigouche region. This has required sacrifice and vigilance from the residents of that area, and I thank them for doing all they are doing. But given the 14-day incubation period of this virus, the new cases can and will appear in spite of all our efforts. And I mentioned that last week when we informed you that there were 300 people self-isolating at home and that any one of them could become positive over the course of the next 14 days as they were close contacts of the cases that were diagnosed at that time. Today, there are 9 new cases of COVID-19 reported in the province. All of these cases are in Zone 5, which is the Campbellton-Restigouche area, where there are now 24 active cases. This is the largest number of cases reported in a single day in New Brunswick in more than 2 months. The new cases are as follows: 2 individuals aged 60 to 69, 4 individuals aged 70 to 79, 1 individual aged 80 to 89, and 2 individuals in their 90s. 8 of these individuals are residents of the Manoir de la Vallée and Atholville, where 14 residents and 3 staff have become infected over the last 2 weeks, and 1 resident has died. 5 Manoir residents are currently in hospital, all in stable condition. To the families of Manoir residents and staff, please be assured that we are doing everything we can to assure the well-being of everyone at this home. 1 reported case has been confirmed elsewhere in Zone 5 today, which remains under investigation, and contact tracing is underway. And again, we will have more information on that contact tracing in terms of the connection to the original cases and if those people have close contacts that need to be isolated. While we continue to learn about COVID-19 as the pandemic unfolds across the globe, one of its apparent qualities is its ability to rest quietly in the host for up to 2 weeks. And it's a really important point because a single round of mass testing, as we undertook in the Campbellton-Restigouche region, will not find every potential case. It's a snapshot in time, and that's why those 300 plus people self-isolating at home are what we're monitoring very closely right now in terms of them developing symptoms and testing positive for COVID-19 moving forward. So we've been closely monitoring and regularly testing the staffs and the residents of the Manoir over the past week so that we could act when new cases emerge, as has happened this weekend. Depuis l'apparition des premiers cas dans ce foyer de soins pour personnes âgées, les patients de l'aile touchée de l'établissement ont été isolés et les membres du personnel suivent des protocoles extraordinaires pour aider à restreindre la propagation du virus. Staff have been trained in appropriate infection control protocols observed, and these are protocols to help limit the spread of the virus. All these residents have been treated as if they were COVID positive from the date that the first case was reported. So even coming in and out of the facility, the staff were aware that because there were several cases already, that they had to really treat the entire residents as being COVID positive in terms of their interactions. We are hopeful that these efforts will help prevent further spread among residents and staff. As the outbreak in Zone 5 continues, the restrictions in place for that region will remain in effect. Residents of the Campbellton-Restigouche region should continue to limit their close contact to those within their two-household bubble and strictly observe physical distancing when outside your home. While this outbreak has not spread beyond Zone 5, the potential for further spread still exists, whether it's from those original cases or whether it's new travel-related cases coming in from our borders. And again, that's why it's important for everybody coming across the border into New Brunswick to self-isolate for 14 days. Compte tenu de la période d'incubation du virus, il pourrait s'écouler au moins une semaine avant que nous puissions confirmer avec certitude que le virus n'est pas présent dans d'autres régions du Nouveau-Brunswick. C'est pourquoi tous les citoyens du Nouveau-Brunswick doivent absolument continuer à faire preuve de vigilance pour freiner la propagation de la COVID-19. No matter where you live in New Brunswick, please continue to maintain 2 meters of physical distance between yourself and others when you're away from home. I know that even after 3 months, it's easy to forget to do this, especially when other aspects of life seem to be getting back to normal. But we want everyone to be safe. And as we have seen, if the virus is given a chance to spread, it will do that. When you can't maintain physical distance, I strongly recommend that you wear a community face mask that covers your mouth and nose. Hand washing is always important, and disinfecting surfaces is very important also. I have seen many people out and about wearing community face masks, and if we do it, then it will be harder for the virus to find new hosts. But the face masks are one part of all of the pieces that we need to do to arm ourselves against COVID-19 in terms of protecting us and our family members and our community members. Until we have a vaccine or some other reliable treatment for COVID-19, we will have more outbreaks. We will have to impose measures to control the spread of the disease, but obviously, after everything we've been through, we do not want to see that happening unnecessarily, and we certainly will be looking at things moving forward in terms of what is absolutely necessary, in considering all of the social determinants of health, collateral damage, and unintended consequences. We will require patience, adherence, and vigilance on the part of every New Brunswicker. But don't lose hope. Hope is what will sustain us through this crisis, as well as compassion and kindness. It will enable us to look after ourselves and to care for others, especially those whose hope might be not as, for people who don't have as much hope as we do. So we need to be encouraging of everyone. Au cours des 3 derniers mois, nous avons montré ce que nous pouvons accomplir lorsque nous unissons nos efforts en vue d'atteindre un objectif. Nous l'avons déjà fait et nous pourrons le faire à nouveau. Prenez soin de vous. Prenez soin des membres de votre famille et de vos voisins. Continuez à faire ce que vous faites depuis le début, car vous contribuez à sauver des vies. Thank you very much.
Good afternoon. Bonjour. As we just heard from Dr. Russell, the number of confirmed cases in the Zone 5 Campbellton region has increased significantly. This news is difficult for all of us to hear. I know we are all thinking about the people who currently have the virus, as well as their loved ones. Cette situation touche tous les gens de Nouveau-Brunswick, pas seulement les personnes de la Zone 5 dans la région de Campbellton. L'inclusion est encore contenue à cette région de la province, mais elle nous rappelle que la pandémie continue de représenter un risque dans notre province. We took action quickly to keep the outbreak contained, and we will continue to do everything within our power and use all tools available to us to protect citizens and staff at the Manoir de la Vallée. As Dr. Russell pointed out, we've been closely monitoring and testing staff and residents since the outbreak began, and residents in the affected wing of the facility have been isolated. We've been working closely with our partners, including the regional health networks and extramural ambulance, New Brunswick, to provide additional staff and equipment. The Pandemic Task Force has put measures in place to limit the movement of staff. Employees of nursing homes or adult residential facilities in Zone 5 are not permitted to work in more than one facility, whether or not they provide direct care to residents. All healthcare workers must continue to be vigilant in completing self-assessments for any symptoms prior to every shift. Staff are also required to comply with all public health measures, including staying home if they are unwell and wearing the proper personal protective equipment while at work. Au Nouveau-Brunswick, nous avons eu la chance de ne pas avoir beaucoup de nouveaux cas pendant une longue période. Nous sommes vulnérables face à ce virus et nous ne pouvons pas nous permettre d'avoir au faux sentiment de sécurité. We have to assume that the virus is still around us. That is why no matter what part of the province we live in, we all have to continue to do our part to protect ourselves and those around us. Now more than ever, we need to respect physical distancing guidelines when we are out in public. And we must wear a community face mask when we find ourselves in a situation where physical distancing is not possible. If you're in a public area, bring a mask with you so you can put it on if physical distancing cannot be made. Je sais que la plupart des gens de Nouveau-Brunswick prennent la situation au sérieux et qu'ils prennent les mesures nécessaires pour se protéger et pour protéger les autres. Mais nous savons qu'un petit nombre de personnes ne respectent pas les règles. A report came out over the weekend about an individual who traveled to Quebec and back and failed to self-isolate before visiting a business in Fredericton. The business voluntarily took steps to close its doors to sanitize and disinfect. This person has been tested and is awaiting the results. The Department of Public Safety is currently investigating the incident. This kind of behavior is not acceptable and puts us all at risk. We know that people will continue to get COVID-19. The self-isolation rule is in place to help reduce the risk of spreading it. Avec tout ce qui se passe dans notre province, tout le monde doit agir avec beaucoup de prudence. Si être sorti de la province, peu importe la raison, vous devez vous auto-isoler pendant 14 jours à votre retour. Ceci n'est pas facultatif. We are continuing to monitor and control our borders. Officers are being cautious and turning people away if their reasons for entering New Brunswick do not meet requirements. Officers are also turning away travelers if they are not certain whether they meet the requirements based on the information available at the time. This can be inconvenient and difficult, but it is all about keeping people safe. Just yesterday, 69 vehicles were denied entry to our province. We are also continuing to receive reports of noncompliance through our toll-free information line. Yesterday, we received 35 calls. These included concerns about people failing to isolate, reports of people not respecting physical distancing rules, and complaints about businesses not following guidelines. Nous avons vu ce qui peut arriver quand les gens ne respectent pas les règles, et nous prenons ce rapport au sérieux. Nous faisons le suivi de tous ces appels, et nous prenons les mesures nécessaires pour que ces personnes respectent l'ordonnance d'urgence et les directives de la santé publique. Right now, we cannot let our guard down. The threat of COVID-19 has not gone away. And we must all continue to take measures to keep ourselves and our loved ones safe. We've seen what we're able to accomplish as a province when we're all focused on achieving a common goal. By working together, I know we can put New Brunswick back on the right track. Thank you. Merci.
Merci, Monsieur le Premier ministre et Dr. Russell. Thank you, Dr. Russell and Premier Higgs. We will now proceed with questions from the media. You have the right to pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. Vicky Hogarth, Charlotte County TV.
Premier Higgs, Prime Minister Trudeau announced today that Canada will be easing its border restrictions with the U.S. to allow immediate family of Canadian citizens to visit, provided they can isolate. What is your reaction to this decision?
We have been discussing this on calls with the other premiers and with the Prime Minister over the last couple of weeks. I've mentioned it here that it was something being considered, And I'm looking for, the details of, the immediate family members and as defined, and what the application process is so that we can notify border authorities and also our scrutiny at the borders, so we can be sure that we're kind of aligned. It's not unexpected. It is trying to unite families, the same as we've done throughout the rest of Canada, and provide, once again, a social environment under the new COVID rules. So it's something I'm sure we can work with the federal government and find appropriate means so that we can do it safely. And the requirement is clear from the Prime Minister that individuals have to self-isolate when they enter our province. They have to be going to a place where they can do that, and that has to be well-defined and determined.
Thank you, Ms. Hogarth. Do you have a quick follow-up?
A quick follow-up. It's also for the Premier. Premier Higgs, will the province be monitoring seasonal resident property owners as they begin entering the province to ensure they self-isolate?
We would be following the same protocol as anyone that has been coming in to date, and when they're coming, whether they live in the province, have a permanent home here, so we're going to isolate and we follow up with calls and random checks. We'll do the same thing with people defined to have seasonal dwellings here and ensure that, they are indeed doing what they say they'll do, to go to these summer places and to stay there for the period of 14 days.
Thank you, Premier. Thank you, Ms. Hogarth. Laura Lyle, CTV. Laura Lyle.
Hi, can you hear me okay?
Perfect.
I'm wondering now, with the latest numbers that have come out from the Manoir de la Vallée, does that mean now with the Alzheimer's wing that there are currently 14 of the 18 people who have been diagnosed with COVID-19?
The numbers that I have are for the total number of residents and the total number of staff that are infected currently. So that's the information that I have shared to date around that outbreak. So yeah, I don't have the exact wing where the infections are at this moment in time. I can just tell you that there's the total number of cases related to the Manoir de Vallée.
Do you have a follow-up, Ms. Lyle?
Yeah, just a quick follow-up. Are there any concerns with the outbreak in Campbellton with the potential for recruiting doctors or healthcare workers to that region, and has that been an issue so far?
Well, obviously, since the beginning of the pandemic and since our first cases early in March, discussions around how each region would be dealing with staff and cases and hospitalizations, et cetera. We knew that there was always a possibility that some healthcare workers could become infected. We knew that some facilities could exceed capacity. So those have always been part of the discussions around any ongoing outbreaks or new outbreaks anywhere in the province. So in terms of having people go to the area to help out, my understanding is there have been staff that have moved up there temporarily to help out, whether it's a situation in Campbellton Hospital or whether it's a situation in the Manoir de la Vallée, that those steps are in place and would be ongoing in this particular situation, and then the same approach would be applied in other outbreaks around the province as they pop up.
Thank you, Doctor. Thank you, Ms. Lyle. Michel Corriveau, Radio-Canada.
Oui, c'est une question pour Dr. Russell. Dr. Russell, j'aimerais savoir, selon vous, est-ce que porter un masque en public, quand on est dans un lieu public, est-ce que c'est la meilleure chose à faire?
Bonjour Michel, c'est une très bonne question. Les informations et les recherches qu'on reçoit sur les couvertures, communauté, les masques, c'est définitivement quelque chose qui aide, mais c'est une chose parmi plusieurs pour protéger les gens contre le COVID-19 et diminuer les risques pour des autres, pour ne pas attraper le COVID-19 de quelqu'un. Alors, le World Health Organization a des nouvelles messages sur ça, puis c'est vraiment détaillé pour dire, oui, quand vous êtes dans une situation où vous ne pouvez pas vous distancer physiquement de 6 pieds ou 2 mètres, oui, portez un masque. Mais vraiment, vous pouvez aussi éviter d'être dans un endroit où il y a plusieurs mondes, éviter d'être dans un endroit qui n'est pas grand, qui n'a pas beaucoup de ventilation, avec plusieurs personnes. Alors, on sait que les risques augmentent quand vous avez plusieurs gens et quand ils ne sont pas capables d'avoir la distanciation physique. Alors, pour toujours diminuer les risques, la province de Nouveau-Brunswick a fait plusieurs choses pour diminuer les risques. On a imposé des restrictions aux frontières. On avait fermé des entreprises. On avait diminué le contact avec des contacts étroits pour avoir des bulles au commencement. Et il y a des mesures qui sont moins restrictives maintenant. On lâche un peu, mais ça ne veut pas dire que les risques sont changés. Ça veut dire qu'on espère que les gens sont éduqués maintenant. Ils ont les bonnes informations pour faire des bons choix parce que c'est vraiment quelque chose que les gens ont besoin d'avoir une vie qui a plus de la chance d'avoir la chance de travailler, la chance de voir leurs voisins et les proches.
Merci, Dr. Michel. As-tu un suivi?
Oui, merci, Bruce. Dr. Russell, par rapport à ce qui se passe au manoir de la Vallée, êtes-vous surprise par la quantité importante de cas qu'on voit là et vous attendez-vous à avoir beaucoup plus de cas au manoir de la Vallée?
Alors, depuis le commencement de la pandémie, on savait que les populations vulnérables incluent les foyers de soins. On a vu des choses, des éclosions qui passaient à Colombie-Britannique, on a vu à Ontario et Québec. On savait qu'il y avait des risques. Alors, pour diminuer les risques, je ne crois pas que le risque pourrait jamais être zéro. Parce que c'est une population très vulnérable. Mais pour diminuer le risque le plus bas que possible, on avait changé, on a limité les visitations avec les visiteurs puis les proches. On avait mis en place des protocoles pour avoir des questionnaires et la température était vérifiée chaque matin avec les staffs. On a recommandé fortement que les gens ne travaillent pas dans plusieurs foyers de soins et ça devrait être vraiment restricté s'il y avait une éclosion, absolument. On savait que au moment qu'il y aurait une éclosion dans une foyer de soins, on voulait vraiment diminuer le transport des gens à l'autre endroit, comme les hôpitaux. On voulait vraiment diminuer le contact avec les autres gens, les autres personnes, et on voulait protéger les staffs, les employés aussi, avec des protocoles de PPE et les mesures d'isoler. Alors, dans le foyer de soins à Atholville, tous les patients ont été isolés. On avait envoyé des staffs avec le programme extramural pour aider avec la santé publique pour gérer la situation. Mais en termes de tous les détails qui sont mis en place, puis les difficultés de vraiment pour vraiment avoir le bon nombre d'employés en place, ça a pris un bout de temps pour gérer. Et maintenant, on est dans une meilleure place après que tout est passé jusqu'à maintenant. Est-ce que je suis surpris qu'il y a d'autres gens qui sont infectés? Pas exactement, parce qu'on savait qu'au premier moment que le premier employé qui était infecté était dans la résidence et même le deuxième employé qui était infecté, on savait qu'il faudrait vraiment garder pendant les 14 prochains jours pour voir si on ne développe pas d'autres cas. Alors, ce n'est pas surprenant parce qu'il y avait des contacts étroits et c'est ça. C'est dommage. C'est pas idéal, mais on gère la situation de la manière plus efficace à ce moment-ci. Mais ça ne veut pas dire qu'on ne verra pas d'autres cas.
Merci, Dr. Merci, M. Corriveau. Callum Smith, Global TV.
Hi, Dr. Russell. Given the reports the Premier mentioned requiring a Fredericton area business to close due to an outsider who apparently didn't self-isolate, how concerned are you that could we could be in for yet another cluster with the same type of travel concerns, I guess?
Well, I will reiterate what I have said several times about what the public health protocols are around contact tracing and cases, et cetera. So in every single situation where there is a positive case of patient diagnosed with COVID-19, public health does contact tracing, and the individuals are contacted individually by public health. If there is a setting where there's an institutional setting or a business setting where people need to be notified, public health does that notification. It's not made public if all the contacts are traced. And ideally, in all situations where, whether it be a restaurant or whether it be a small gathering of any kind, there should be a registry whereby all the names and contact information of every single client or visitor to that establishment in a set period of time is recorded. That is in the advice from public health and WorkSafe around the safest way to have people in an establishment, so that if there was contact tracing needing to be done in that kind of a setting, and we have been provided with those kinds of lists in the past, then each individual will be contacted. And then if there was a public exposure, then you would be hearing from me in a press release or a press conference that there had been a public exposure based on a positive case. But I was not presenting any of that kind of information today because that's not the situation as it has unfolded. So that's all I can say about that particular situation.
Thank you, Doctor. Mr. Smith, do you have a follow-up?
Yeah, I guess for the Premier, Premier obviously understanding that there's not a notable issue at this point, but how concerning is it to hear another story of someone apparently having disregard for the self-isolation requirements?
Well, it continues to be a concern when people, I guess, when things are taken for granted, and that we had a great run. We hope to get back on that run, but the situation in Atholville is certainly a clear illustration of when the virus gets away, it can be a major problem. So I find it concerning, especially given what we've seen over the last couple of weeks in Atholville, and I'm just only encouraging people to continue to take precautions, to have their mask with them so they can put it on if they're in any situation where they can't provide the appropriate social distancing. We cannot get complacent. We can continue to see family members and close friends. We're opening up our province. We're seeing businesses coming back. I've had different businesses say they've had a great last few weeks or last month as things have opened up. So people are anxious to get back to a new normal, which is different than the past. Let's not lose it by, let's say, everyone not being part of the solution rather than a few being a significant part of the problem.
Thank you, Premier. Thank you, Mr. Smith. Colin McPhail, CBC.
Thanks, Bruce. My question is for Dr. Russell. Almost 2 weeks have passed since the first case connected to the long-term care home in Atholville showed up. Were any of the cases announced today people who tested negative earlier, as you just learned about, or just after you'd learned about the outbreak at the home? And I guess, what does this mean now for testing in Zone 5? Should other people in the health region be tested again too?
So as of the first few cases that were known and all the contact tracing that was done at that point in time, we knew that every single contact that was self-isolating at home, they all were tested, but we knew that that was a snapshot in time and that we had a 14-day window to wait to see if they were going to develop symptoms and become positive. So there was never a question in our minds that those tests, even if they came back negative, was going to be something that was going to reassure us at all. It would just make sure that we picked up as many cases as we could who were positive at that time on that particular day. And yes, we have continued to test people at the Manoir de Vallée, but everyone who is at home self-isolating right now is symptom watching, and they will call 811 and get tested if they need to. So public health is checking in with them every single day. And so every single person who is self-isolating, I said there were over 300 people, there was no question in our minds that we would have 14 days of watching to see if any of those 300 people became positive for COVID-19, and that if they did, that hopefully, obviously if they're self-isolating at home, there would be very, very, very few close contacts, and obviously would be just the people living in their home, if at all. Again, if they were able to self-isolate by not sharing a bedroom, not sharing a bathroom, and not sharing any personal items, then the risk of, and people were wearing masks in the home, then perhaps the goal obviously would be that as few people as possible who are self-isolating would transmit it to anyone else, but the risk was going to be there. And so with the latest cases, most of them are in, there's only one new case that is outside the Manoir de la Vallée, so that person is having contact tracing done today. And whatever that information provides to us will inform our next steps, but we knew we'd have a 2-week period where we'd have to watch closely for those 300 close contacts, known close contacts who were self-isolating, to see how many of those would become positive and go from there.
Thank you, Dr. Mr. McPhail, do you have a follow-up?
I do, thanks. This one is for the Premier. Last week the province said masks will be mandatory in public buildings come Tuesday. This decision obviously has since been reversed, and I'm wondering, why was this decision made in the first place, and will it be implemented eventually, and if so, when?
The original intent, so it was not intended that to put a mask on everybody who walked into a door. It was intended that everyone would actually have a mask with them, so they were able to put it on if needed. Because once you get inside, the concerns were once you get inside, then you're in a situation where you can't, if you don't have a mask with you, you can't do much about it. So that was the intent of the original order. It, unfortunately, wasn't quite as intended, so we corrected it. And, we had obviously a number of people question why they would have to do this if they were able to social distance. But I think the important part to take away from this is simply, when you leave home, carry a mask with you, so that you can always put it on if needed, but you certainly can't do that if you don't have it on you. So that was the plan, and it was corrected over the weekend.
Thank you, Premier. Thank you, Mr. McPhail. Edouard Rodriguez, Kilibash, Radio-Canada.
Hi, yes, cette question is for the Premier. As you know, Chantal Moore's family has just arrived in Nouveau-Brunswick. Can you confirm whether or not they need to self-isolate for 14 days upon entering in the province? And can you give us details? Sorry about that. Can you give us details about what kind of arrangement was made with them?
Hi, sorry, I didn't get your name and the organization you're with.
Sorry?
I didn't get your name and the organization you're with.
Eloise, Radio-Canada.
I can't hear you, sorry.
Ah, OK, merci. Non, je voulais savoir, j'ai pas entendu son nom, puis j'ai pas entendu
Oui,
le...
non, je suis désolée, je suis dehors. So
Oui.
the question was to know whether
Non,
Chantal
j'ai
Moore's
entendu.
family needs to
Yeah.
self-isolate for 14 days upon entering
Yes.
the province, as
Yes.
they're there already.
Yep.
And what kind of arrangement was made with them in that effect?
So first and foremost, I just want to say that our hearts go out to the family. At this point in time, it's obviously a very tragic situation, and I think that out of respect for the family and confidentiality, I don't really want to discuss the details, other than to say, because I don't discuss individual cases and details around situations, but what I can say in a general sense is, from the beginning, we have, on a case-by-case basis, made compassionate exemptions, and then the details of those compassionate exemptions are worked out between public safety and public health in terms of what protocols need to be followed. So I would like to leave it at that, only out of respect and for the family, and out of respect for this very, very tragic situation, and for the reasons of confidentiality, which I would like to respect.
Thank you, Dr. Eloise. As-tu un suivi?
Yeah, so just to confirm that there was a compassionate exemption made in this case?
Well, again, I don't want to speak about specific cases. I'm just saying that on a case-by-case basis, public health will make compassionate exemptions, and out of respect for the family and out of respect for their privacy and confidentiality, I don't really want to discuss their individual situation.
Thank you. Andrew Watt, Telegraph Journal.
My first question is to the Premier. Premier, can you give us an update on the case of Ontario Councillor Stephen Wright? He apologised. Last we heard the matter was still under investigation. Where is it at, and what did you think of his apology?
Well, firstly, I think the investigation is still underway, and so we don't have any update on that. I'm looking forward to see that. Yeah, I mean, obviously, I accept the policy, but I feel that it was certainly an unnecessary trip. It put people at risk, and I think Mr. Wright now recognizes that, but we will continue to investigate it.
Thank you, Premier. Do you have a follow-up today, Mr. Watt?
I do, and it's actually a non-COVID question. Premier, could you talk to me about the appointment of Deputy Minister Tom McFarlane to two portfolios that, you know, often one is regulating the other, and why that's appropriate and not a conflict?
Well, I guess to speak on the legal terms, firstly, we consulted the legal office to determine if it was a conflict or not, and it was determined it was not. Secondly, the responsibility of government for environmental concerns, for, you know, in this case for forestry, natural resource practices, but environment is every department's responsibility, and certainly to suggest that we do one completely independent of another in government. I mean, I can understand how this can be more controversial if it's not all government operations, but it is. And I think we've often been accused of not having good, let's say, collaboration or understanding or communication between departments. So although this is a temporary or an interim position at this point, it's been determined it's not a conflict. We feel it'll work very well together, the two departments, and we've learned through this COVID crisis the last 3 months. Really how well departments can communicate and work together, and we need to find ways to just keep that going and improving it. So although this is as I said, it's an acting role at this point for Mr. McFarlane, it is not a conflict.
Thank you, Mr. Watt. Thank you, Premier. Elizabeth Fraser, CBC.
Hello, my question is for Dr. Russell. Can you please go into more detail about your response to the outbreak at the long-term care home and what you mean by treating everyone as if they have already had COVID? For instance, were all the residents, regardless of which part of the home they're in, separated from each other? And did you test everyone and not just staff or the affected unit?
So when I say that everybody was treated as COVID positive, the PPE protocols, so the personal protective equipment, the isolation protocols, those were all put in place for each and every individual in that residence. Each and every individual was tested. Each and every staff member were tested. And then the ongoing symptom watching, I mean, they are being monitored several times a day for temperature and symptoms. And there's a very low threshold, obviously, for getting anybody retested. And in fact, the staff is continuing to be tested regardless of whether they have symptoms. So that's in place also. Does that answer your question?
Yes, thank you.
Ms. Fraser, do you have a follow-up?
I have another question for the Premier. When you were speaking earlier about random checks, I take it you mean government officials make surprise visits to people who are self-isolating? How many of these random checks have been made and what are the results?
Well, what I meant by that is it could be a visit, but it could be phone calls, because we get all of the information in relation to contact points so that calls can be made just to confirm that people are isolating or they're doing what they said they would do when they cross the border. So it's a combination of both. I really don't have the number of how many have been made, but it's a kind of an ongoing kind of practice. People need to understand that we can and will check up, and otherwise sometimes, you know, the 14 days turns into 10 or 6, and so it's always good to have a little backup understanding.
Thank you, Premier. Thank you, Ms. Fraser. Adam Heuris, Telegraph Journal.
Thanks, Bruce.
Question for the Premier. Prime Minister Trudeau says he's offered the provinces a total of $14 billion towards what he's calling a safe restart plan. Is $14 billion enough? And do you think the funding should be per capita or based on the impact the virus has had in each province?
You know, this has been a discussion point over the last several weeks, and I think certainly the related costs that have been impacted by the province should be a factor in any of the calculations, so that we do understand, you know, what has been the significant impact, and that can be from a number of categories related, health, tax loss, whatever. There's also the combination of, you know, as we start up, being able to define what startup looks like and how companies are moving back and being able to move as they would. I've had reports from a number of companies that are doing very well and actually have had record months in the last month or so. And it's a lot related to what we're seeing with people investing in properties, or let's say home renovations, or even maybe there's addition work in the housing starts. But I would like to see a definition. I haven't seen the details around this announcement because I think it's important that we categorize across the country what that looks like. Per capita, you know, never does very well for an Atlantic province because we certainly don't have the population. We can have the expenses in many ways, but we don't have the population if it's per capita. So I'm always a little bit leery of that formula all by itself. But the details, I assume, would be forthcoming. We'll have another call this week, and maybe, but generally it takes a few weeks to iron out the facts.
Thank you.
Do you have a follow-up there, Bruce?
Mr. Hirsch, do you have a follow-up?
Yes, please, thanks. Same subject, Premier Higgs. Trudeau's looking to attach strings to the money. He talked about dollars for 10-day sick leave pay, help for municipalities, dollars specifically for childcare, and a number of other subjects. Are you fine with that, or is that too restrictive? And what do you want to spend the money on?
Well, I would like to see flexibility. It's the same with our infrastructure funding flexibility, so that we can defer costs that are going to come at a later date in the months coming or the years coming. Educational costs as we get started up, and you know what that might look like. I would like to be having discussions too in relation to let's say a national education policy, so we can understand what going forward, what other jurisdictions are doing, what the standards, you know, working with public health and work with other educators as we figure out what is the best approach for startup of the schools. The more flexibility we have, the more fine-tuned we can make it towards our actual needs. And I don't want to download costs onto businesses. And I know in relation to the additional 10-day sick time, the concern there is only that, you know, it's if people were tested, if they feel sick and they're tested and they do have the virus, and absolutely, then the 10 days are there. If it becomes 10 days, it's just there without any sort of understanding around that, then we're going to get, businesses are going to run into the same sort of situation they have today, where it's difficult finding employees. So we just have to be cognizant of that, so that our startup of our companies and businesses can continue. It's been going very well over the last several weeks. We're seeing a big shift. I think we're almost at 60% return now, up from like 26. We're tracking real movement in relation to the startup, and I'm hoping to have a scorecard around that would allow us to really see where companies are moving, to what extent they've fully up and running. I want to make sure the money is available to where it's needed.
Thank you, Premier. Thank you, Mr. Harris. Alexandre Boudreau, l'Acadie Nouvelle.
Bonjour, ma question est pour le Premier ministre Higgs. Je veux savoir, vous avez modifié votre consigne sur les masques et vous avez dit que la mesure n'était pas à accroître les attentes envers les entreprises ou le public. Premièrement, pourriez-vous clarifier ce que vous voulez dire par ça?
The point we had, businesses have done a lot of good work in monitoring their activities. They have put the restrictions in place. They've, You know, they've certainly gone through to put social distancing in many of the bigger places, the retail. They've had people at the door, allowing so many people in. Restaurants are doing the same. I mean, you go through the process. So the idea here was basically, you know, we wanted people to always have a mask with them so that they wouldn't find themselves in a situation where they suddenly couldn't social distance, but they didn't have the proper protection. So that was the goal of this, you know, and I'm hopeful that it's all part of trying to start up in an incremental way that allows our society to function and function as best that we can in a new environment. You know, will it happen that we could get to that mandatory requirement? I hope not. And the goal was to initially just ensure people had a mask. So you didn't leave home to go into a public space, particularly in a building, and where you could not avoid being closer than you wanted to be to other people and therefore having the proper protection.
Thank you, Premier. Monsieur Boudreau, as-tu un suivi?
Oui, deuxièmement, je voulais savoir si vous avez songé à un plan pour des masques ou pour rendre les masques plus accessibles. Et si c'est le cas, est-ce que, comme vous l'avez mentionné, mais est-ce que vous allez remettre en place l'obligation de porter un masque dans les bâtiments publics en tout temps? C'est encore pour le Premier ministre.
Well, at this point, you know, we haven't put that as a mandatory requirement to wear masks at all times in public buildings. We, and I think there's also the discussion around what type of mask, and Dr. Russell may want to speak to that as well, because it's basically having a face covering and that's, you know, can be readily available. So it's not like it once was discussed around medical masks. So I think that at this stage, we feel that if people follow the rules, they follow the rules of the retail or business, they are careful to protect themselves and others, and if they're in a closed quarters, have a mask available to put on. It's, you know, it goes along with the whole prospect that if people want to avoid public health rules, they can do that. We will never catch everyone. We'll never avoid it. But they shouldn't lose sight at who's at risk. Their grandmother, their parents, their friends, their neighbors can be the ones at risk if they choose to ignore the rules. And because it isn't a case where we're going to find a way to enforce all of these, it's a case of people continuing to do their part. We've had a great run. We hope to be able to get back on track. We've had a setback, obviously, in the special care home in Atholville, and let's not lose sight. The virus is here. It's live and well in New Brunswick. And let's not let it get any farther than it is now. Let's put it in check.
Thank you, Premier. Merci, Monsieur
Sorry,
Boudreau.
my apologies. My question was if government is looking at ways to provide masks or make them more easily available. Just if I could get a quick comment on that, sorry.
Well, we have put, I think, an indication of where masks can be purchased, but online now there are all kinds of different masks and companies that are fabricating masks of various types and styles. So that information is readily available, so we are not planning to do anything more at this stage. I guess we'll monitor if that becomes a concern, but given the types of masks that can be used are broadly, a broad range, I don't think it's a real problem.
Merci, Monsieur Boudreau. Natalie Sturgeon, Telegraph Journal.
Hi, my question is for the Premier. What are the specific rules about interparental custody agreements where one parent lives in another province and the other parent lives in New Brunswick with the children, and why would that person be denied entry to the province despite being told by the hotline that the government set up that he could enter but was denied at the border?
My understanding is that information is actually available on our website in terms of travel exemptions, and one of the travel exemptions is around joint custody. So if you want to refer to our website, that information is clearly in the exemption part of the travel issues and situations.
Thank you, Dr. Ms. Sturgeon. Do you have a follow-up?
Yes. So when public safety officers encounter a situation where they might not be sure, who are they taking direction from at the border?
Public safety is in charge of the measures that are in place at the borders. So, and again, they have the same information in terms of what the exemptions are around child custody agreements.
Thank you, Ms. Sturgeon. Nicolas Steinbach, Radio-Canada.
Oui, merci Bruce. La question est pour le Premier ministre. C'est concernant la situation avec l'Autochtone Chantel Moore qui a perdu la vie la semaine dernière. Je voudrais savoir si le gouvernement a entamé une enquête du coroner et c'est quoi l'objectif?
There is a full investigation being done right now, and that is an independent investigation through, and it's the Quebec authorities. Generally, we have investigative work done. In our case, we usually have an arrangement with Nova Scotia. In this case, Nova Scotia authorities were not available. So we have Quebec authorities that are helping us with this as an independent review of actually what happened, all of the circumstances around this very unfortunate situation. And I will be awaiting to understand the full details.
Thank you, Premier. Monsieur Steinbach, as-tu un suivi cet après-midi?
Oui, un quick follow-up. Merci, Bruce. Toujours pour le Premier ministre sur le même sujet. Il y a des personnes qui demandent pour une enquête nationale concernant les relations entre les policiers et les Autochtones après cette histoire avec Chantel Moore. Qu'est-ce que vous en pensez? Est-ce que vous seriez ouvert à ça, à une enquête nationale?
I think certainly in this case locally, we're very concerned about what's happened here and understanding all the details around that. And to discuss, the merits of a national inquest, certainly I would be open to that discussion and to understand the merits and the benefits and how we can get to the bottom of many tragic incidents that we've seen over the past number of years. But right today, I'm very focused on the one that happened just recently here in Nouveau-Brunswick and understanding completely the details around it.
Thank you, Premier. Monsieur Steinbach. Voilà la fin de notre mise à jour. Merci beaucoup. That concludes today's update. Thank you.